very much. I'm going to talk today about physiologic decompression of the lumbar spine stenosis through anatomic restoration using a transcambine oblique lateral posterior lumbar interbody fusion with Olive technique. We know from many experiences that longer surgery has more complication associated with them. So we know, as a matter of fact, that surgeries that are more than 2 hours have twice the rate of the complication than surgeries that are less than 2 hours. And we know from our routine that surgeries through many approaches are offered to the patient. I'm going to talk to you about the surgery that practically has made a 6 and 9 hour surgery to a 1.5 hour surgery, and see if it's successful to reduce the radiculopathy and symptom of claudication in the patient. These approaches are going to avoid the posterior and anterior element, the oblique lateral posterior lumbar interbody fusion, and associated with that is that we don't cut the muscle, so we don't spend the time to cut the muscle and stop the bleeding, and we obviously don't cut the spine, and we don't cut the lamina. That would be a direct decompression, so we are avoiding that by restoring the height of the disc, as you see here, with the placement of the cage, interbody cage through a tube. The result is that obviously those muscles don't die, and on the right side you see that the Olive approach has preserved the muscle. The result shows that we can do that surgery for 1 hour, for one level in less than an hour, and send the patient home mostly in 1 day with a blood loss that's about 50 cc. Oswestry improves very significantly. As well, we have shown that complete resolution is achieved in more than half of the cases, and more than 75% of the cases, significant improvement of the radiculopathy and spinal claudication has been achieved with a surgery that is generally about 50 to 60 minutes for a one-level fusion, which includes 1 cage and 4 screws. We have shown with the early and late complication that the results are very comparable to other approaches. As a matter of fact, in many regards are less than open surgery, especially in the blood loss and some other limitation that the surgery will bring with itself. Most of these patients, more than 96% of them, ambulate within first 24 hours, and it makes sense that this patient go home within 24 hours. No other fusion can compare to rate of ambulation early on. The surgery is done with the double C-arm, and that enables us to have, with special instrumentation, do the discectomy, prepare the end plate, and put a cage in. Result on the X-ray looked like a T-lift without any disruption to posterior element, and this can be done for multiple levels, and the rate of infection is 0.16%, and average rate of infection is 3 to 8% has been reported, and we have shown that this surgery as well can be done in higher BMI without any any additional risks involved with that. Thank you very much.